settlement funding. Who wants to start? Okay.
So Sam and I have been working with Sheriff Hepperly and Andrew on ways that we can assist them in dealing with substance use in the jail. One of the items that we have been discussing is placing a vending machine out by or the back area where the public is going. I'll let them talk a little bit more about that area, but to make sure that we're getting some risk reduction supplies out to those individuals that may be themselves or being around individuals high risk for overdose of opioid. And then we were also looking for a place here in town locally as well to place one. So I'll just start it, but they have been doing a great job of discussing it.
Well, hi, I'm Sam. We have been talking about this for a while. I've been working in partnership with about 6 other health departments around the state that have also placed vending machines. I prefer to call them risk reduction vending machines, not harm reduction. Not just naloxone will be placed in these vending machines. Will also include personal care items, gun locks, other things that can be used for safety, housekeeping. And so by placing it out of the jail, the target population there is obviously the individuals recently incarcerated and released. They're at about 129% higher chance of overdose within the first 2 weeks of their release, just because they have had decreased use. They are not able to use the same amount they were, but they a lot of times think they can. And then also the change in the drug supply in the community, unfortunately. The biggest item will, of course, be the naloxone in there, and we plan on putting a kiosk next to it that will play a video made by a couple community members here on how to respond to an opiate overdose, the signs and symptoms, and then naloxone administration. The one place of the jail, we're looking at the lobby where you come in for either fingerprints or to turn yourself in. It is a P Slim model, and it does not have any cost. So individuals can just go up and select A3 and then out comes the naloxone. Looking at like the cost effectiveness of it, it does cost money. However, you save about $11,200 a year from the deaths that you avoid from an opioid overdose within the community. So I also look at it as a way of, we can help reduce the recidivism just by showing people that we care, reducing that stigma, showing they have support, law enforcement is on their side, but also knowing where they can get information on how to stay safe, but also where to get referrals and information when they choose to go into treatment. So with that, I will let them go into anything they have to say.
We'll have Andrew just the placement and give you an idea of, it's the jail public entrance. There's another kiosk there where the public uses to deposit funds in for the inmates for their commissary phone accounts. So let Andrew take it from there.
So our jail public lobby is where, you know, anybody that's coming to jail, anybody that's family, friends that are coming to visit, to post bond, to deposit money on their accounts, that's where everybody's coming in to our jail. The only ones that don't come in that way are the ones that are arrested by officers. However, when they are released, it is also where people are going to be released from jail. An example of kind of how much people pay attention in there, we have this is what meth is made of poster out in the out in that lobby, and it kind of itemizes, you know, what all people are putting into their body. I can't tell you out of all the years we've had that out there, how many people say, "Oh my God, I can't believe that's in the drugs." So it is an area where people are observant, they're paying attention. I mean, this is a decent sized machine. It would be right next to our money kiosk, so they can't miss it. They would be looking in it. It would be beneficial if they're, you know, looking at it and saying, "Hey, yeah, I'm a drug addict. I could use the naloxone," or my family and friends are, you know, to help save lives that way. But I think it would get a lot of foot traffic. It'd get a lot of notice to it. Aside from the kiosk that'll have the short video, In all of our cells in our jail, we have kiosks where the inmates can access their funds. They can order their commissary. We also have a video on there that all inmates will be required to view when they first go to log in. It's going to say, hey, you're going to have to watch this short video. So that way, whether or not someone takes it, we know they've had the education on how the device is used, what the purpose of it is, to fill any desire that they have any prior knowledge of it. But yeah, it's kind of breakdown where we'd like to have the item placed.
So this is, no money involved, you just hit the numbers or whatever and it falls out?
Yeah.
And I know they're fairly expensive for the actual machines. So what's the benefit of having a machine over just having the items kind of sitting there?
Organization. I'm sorry.
Go, I'm sorry, yeah.
Number one would be organization. It would be contained in the unit. That way they can select what they would like to have out of there. It would drop. And then that way we wouldn't have just say like a box of items that are open that people are rummaging through. And just, I think number one, it'd be just the organization of the products inside.
I would go with tracking as well. It's going to be a better tracking system for us to know the items that are being placed in there. Are they moving? How many people are taking them, or how many items are being taken? I was in a community meeting last week, and it was shared that here locally, it's being reported that the drug dealers, when people are coming to purchase meth, they're slipping a sample of fentanyl in there as well for free to get them to try. So we've got an upcoming serious issue in our area if that's what's going on. And it's from an individual that it's coming firsthand from him or to him, I'm sure.
So you say sit in the lobby, I know where does that drop all used drugs, that dispensary or whatever they all call it, collection area? Where's that?
So this one would be our jail lobby, which is on the southwest corner of the building at our jail entrance. Not the main front lobby for the sheriff's office. And mainly, the purpose of back there versus up front is most of the people that we let out of our jail don't ever see the front of our building. Either they're having their ride pick them up there, or, if they decide to walk, they're not making a stop on the way. It's somewhere where they're going to get the foot traffic. They're going to walk by and see it.
So these would be free to whoever? What's to keep somebody from like just continually hitting the button and taking 5 or 6 of them and
It would be okay. They're getting it out into the hands of the people that are needing it, whether it's them or their buddy.
There is this hoarders mentality is what we like to call it, even in our community lockbox where I can put a bunch of supplies in and one person doesn't know when they're going to get it again. And so they tend to take it all. But I work with this community very, very closely and they share, they talk, they give supplies to each other. They really are a community that cares about one another. So
is there a cost on this machine?
there is a cost for the machine, so we're looking at 2. I probably should have highlighted on that part. The second one, we're looking at it being placed at Crisis Stabilization with 43 North Iowa, downtown Mason City, kind of the hotbed where we're seeing a lot of this action. With it being open 24/7, people accessing mental health and substance use care there a lot. We feel that that would be a great access point, and both Jen Hansen, Jen Faust, and John Derryberry have given us their blessing and place on there. The cost for the machines, very rough estimate right now with tariffs and all of that, but we're looking at about $9,000 for 2 refurbished machines. They're not heated or cooled. They're just simply refurbished vending machines or snack machines. That do require electricity, but
I'm assuming there's like small, medium, larger type. You said in other items in the machine.
so this is a small one. I want to say there's 3, 6, 9, 12, 18 snack sections, I'm gonna call them. It's this little slim gen, and you can certainly have this little flyer. It talks about the dimensions, the size. Yep, there's 12 sections in there. We will look at the rotating stock of it. Let's say one product is not going through, we'll remove that and replace it with something different until we kind of see what the community that's coming to that machine is needing or requesting. As far as cost for stocking it, a lot of this we have covered in other grants, programs, through donations. For instance, the VA comes to a few of my community meetings and they have dropped off gun locks for me for free. My SPOTS grant, or it's an HIV hepatitis reduction grant, it provides a lot of these supplies for free as well, not even of a cost from the grant. So, and of course, our community partners, like the homeless shelters, they are willing to give us a lot of supplies that they have that are overstock.
So that naloxone, is that how you pronounce it? Naloxone. So in the wrong hands, so to say, I mean, if I stab Casey with or whatnot, what's the downside? Other than Casey getting pissed at me.
So it is not an intramuscular, it is an intranasal. So you just spray it up the nose. There's no contraindications for taking it. It can't cause any bad side effects or adverse reactions.
Just in case it would got into the wrong hands and
Yep.
somebody used it as a weapon, so to say.
The only adverse reaction is if you were allergic to it. And from what I've read, that's less than like 0.05% of the population.
Sounds like a good idea to me. Are there any other counties, communities that have done this that you've heard positive feedback from?
Yes, so Polk County, they probably have the largest number of them. Blackhawk County has purchased them, Johnson County, Dubuque, Lynn County for sure, they've got a lot. And then I want to say Bremer. It's another smaller county. There's a lot.
So that just because I don't know, how much is the naloxone? Like a dose that they would get on the machine, what's that cost, so to say?
So it kind of is going to depend on the pharmaceutical market, but it's an average from $30 to $50 for a box that contains 2 doses. And usually we go through like Amazon and get it, the generic formulation. So it's the cheapest we can get it, around $30 a box.
The locks, gun locks?
Free.
Oh man,
Oh,
there gotta be an initial cost.
no. They were just donated to us from the VA.
The naloxone in that machine wouldn't qualify to be paid for by the state. That's only if it's to entity that delivers it professionally here.
No, the naloxone from the state supply, we've looked into it and we're actively trying to work with the state on some suggestions and feedback on that. It says right in the guidelines that you cannot place the naloxone from them into machines or receptacles. It has to be individually given out.
So where else in town can they get it? I mean, public health, the hospital, Prairie Ridge.
The only place you can get it for free would be public health, friends of the family, the homeless shelters, and I believe that's it for free. Otherwise, you can go to any store like Walmart, Target, Walgreens and get it, but it's about $40 a box. Which we know this population. I love them, I care about them, but they're going to choose their drugs over a box of naloxone if they have $40 to spend.
The 2-dose box.
There's several counties that are working with the state, as Sam had said, about trying to get the state's guidance to allow for that naloxone to go into the vending machines. More to come, but there are conversations going with that.
I was just curious on the size of the machine, and I agree with Casey's comment, it sounds like a good thing, but is that a little overplay? I mean, as far as machine size, is there something else out there that you can get? Maybe it doesn't have to be refurbished, but that can hold like 4 to 6 items instead of 12 that won't take up the space or the, just a question.
Balancing that and the staff time that it's gonna take to keep it replenished. Because it's gonna be Sam or another individual that's gonna have to keep replenishing.
But my part 2 of that question would be, I mean, if successful or whatnot, I'm sure you probably want to do other locations eventually. $9,000 here, $9,000 there. That's what I was wondering, versus a smaller machine that would just dispense the 2 to 4 items that you want to concentrate on. But other than that, I'm in favor.
It's 4,500 each for the machines.
It's about, so I tried quotes from 5 different places and they've just been horrible about getting back to me. But the best one I can find is $3,863 per machine with an estimated $200 tariff for each. These ones are coming from Wisconsin, ABS companies.
It just come out of the opioid funding, correct, Heather?
Is this Andrew stocking them or
It'll be me. I'll be the one stocking them. I already go out to the jail.
do you need any more work?
Exactly, right? So I go out to the jail once a week or once a month for testing services. But also we're looking at a peer support program there to help reduce recidivism rates and some jail education programs. And so I'll be out there plenty to be able to keep stock and fill it when I need to.
And on the other side of that, if we notice, or my staff notices we're short on something, and we have Sam's contact or email, we can let her know, hey, we've run out of, I don't know what was in A3, but it's gone.
I should mention too, the monies that if we decide to go with this, will come out of the public health already. The funding that public health is utilizing, it wouldn't be extras out of the main fund.
Part of the 70,000 of opioid funds.
Okay. Yeah.
Any more questions? Dylan, how about you, Carl?
What are the items you want to put in it?
So the items I did, because I knew that would probably be a good question. Here's a list of potential items. That way you can see them and approve or disapprove of anything that we don't like on that list. A lot of them, like I said, are just basic personal care items. Actually, when I made this list, I asked a couple stores, what are the most commonly stolen items in your area? And that's where I got some of these items, just because people do what they need to do to survive. So it's just a mixture, like I said, of personal care items, harm reduction or risk reduction supplies.
$312 delivery for $29.99 delivered to your door. I'm just looking at how much just everything's going.
There's items like Sam said that you don't feel like you want in there, just let us know and we won't. There'll be different items in there. We can't fit all of them at one time, but we'll rotate them out as best we can. With naloxone being installed.
Yeah. That's where the focus needs to be. Associated with that, so.
Sharps containers, if we can get those fit in.
Yeah, and they should be able to, the little black ones. I will say we've gone over, distributed over 300 or 400 Sharps containers within the community. That's going over very well. A lot of people are reaching out for those, so.
Why don't we noodle on the list, and if there's anything, maybe we can reach out to you guys individually and share our concerns, and if there wants in a discussion, we can get together. That makes sense.
or any suggestions.
Yeah, so as far as I'm concerned, go ahead.
And it's within your budget already.
We just wanted to be transparent and upfront.
Appreciate it.
So technically you can do it anyway without this.
But we would.
Thank you. That's a great idea. And you think those are if you're gonna buy two, those are the two places that are the biggest benefit would be the jail exit and the 43 crisis help center?
So, and we can always move them. I mean, if we find that it's not a good spot or they're not being taken care of, not probably the jail, but the other.
That's inside a heated area, both of them. Secure heated area.
You got, problems with them or whatnot, you got somebody lined up to,
They do provide, if my understanding is right, like service on them for the first year after you get them, but they also, when they come down to install them, they train me on a lot of that stuff, so.
especially when you said refurbs, you know.
Mhm.
So you'll be good with the vending machines so we can tell the girls when there's problems downstairs.
Right, just call Sam.
A local company that does this, that delivers them and
This one,
services them.
there is not one that's local that I can find. The closest is Wisconsin.
Red line thing.
And we could check into it because they have a lot of vending machines in this area. See,
Just for ease, if something goes wrong, I didn't know.
Yeah.
I prefer if it's the same price to go locally, we have
Yeah.
local service and keep our money in our community, but if not, you can't.
And when I asked about the machines before, the cost or whatnot, I guess my initial thing is, and I'm sure there's targeted areas, but you know, what about Clear Lake or Rockwell or the other communities in the county?
Mhm.
So that we're not all about Mason City, you know?
Absolutely. So that's something that I'm looking at. I think a big problem that I'm noticing is we don't keep very good data. You know, I can't and don't know where to support a lot of these initiatives. And I think with our new ATODS dashboard, we'll be able to pinpoint areas where a lot of calls are occurring. Like, I want to think of what was the EMS data. We've had like a 200% or 400%
oh, yeah,
overdose, and just EMS is responded to within our county. So as I get more data, I would like to have more targeted efforts. A lot of it too is slowly educating the public about this. I think people, they hear harm reduction and they think syringe service programs are cleaning out, passing out clean needles. But to me, it's just taking care of people, preventing a death in the community. Keeping our hospital not overrun with sick patients and.
Sounds great. Just try to reach out to a local vending company, see if anybody wants to partner with you, maybe get filters.
All right, thanks, everybody.
Thank you.